Hi, I am Dr. Ravisankar Reddy, Senior Gastroenterologist and Hepatologist working in Yashoda Hospital, Malakpet. Today we will be discussing about some of the facts about colonoscopy. Colonoscopy is a simple day care procedure where doctor examines your large intestine from the anus, and it's a small camera which is attached to a tube. Usually colonoscopy is a very simple procedure. Most of the patients or the general public think that it is a very cumbersome and a difficult procedure and with much more pain. But it should be done in a short sedation. So it is very simple procedure, day care procedure, where it can be done in maybe 10 minutes to half an hour, and patient can be there in the hospital for 1 to 2 hours and can go home. There are specific indications where you need to undergo the colonoscopy. Usually colonoscopy is done when your age is greater than 50 years and there are some alarming features like blood in stools, weight loss, you have anorexia, means loss of appetite, or you have a family history of colon cancers. Sometimes you have constipation or diarrhea where they are not responding to medication. Then these are the indications for doing a colonoscopy. Usually colonoscopy detects any cancers or any polyps or sometimes tuberculosis, IBD, that is Crohn's disease, or ulcerative colitis. There is no specific age to undergo colonoscopy. It is the only indication which is for the colonoscopy, because most of them who are crossing 60 or 70, they say I am more aged, so I cannot undergo a colonoscopy. Usually colonoscopy most of the times indicated in aged only. So it's a simple day care procedure we do in Yashoda Malakpet with a small sedation, and 1 to 2 hours you will be there in the hospital and you go home. Thank you.